Welcome back, my good people, and it's good to see you back in this particular video, a channel that you learn medicine at the comfort of your home. Thank you so much for joining this particular video today. For the new guys who have just joined now, kindly click this notification bell, written subscribe, turn it on for more videos that we post. And also, I'm appreciating the loyal subscribers who have been here with me since day one. And up to now, they are still soldiering on, they are still dropping their comments, they are still sharing this particular video. Now, what happens to your penis as you age? This is a very tough question that some people want to know more about it into details. But first of all, I want to debunk the myths that are circulating in the social media about this particular topic of what happens to the penis as you age. So stay tuned with me, watch, like, subscribe, and do share this particular video. Aging causes impotence. This is a particular myth that surrounds every social media, and this is not true. When you age, there are factors that we will learn in this particular video. Aging also only increases the risk of being impotent, that is erectile dysfunction, but it does not guarantee that all of us who are old, who are clicking maybe 60, 70, 50 years old, now have erectile dysfunction. It's just a matter of high risk, and this is case by case, depending on someone's health, lifestyles, and even the types of food this particular person normally eats. And again, penile size decreases drastically with age. This is normally not true, and what is normally occurring is that it is influenced by weight. Those who have obesity sometimes might notice that there's some little penile shrinkage as they grow old. So this is case by case, and every man has his own experience, and every man will also report a different scenario on the penile tissues versus growth as the person ages. Now, let's see what will now happen to your real penis, backed with science and in relation to anatomy, physiology of male reproductive system. Aging versus testosterone level is normally very, very important, and kindly note that when you are growing old, testosterone levels normally tends to go down, and when you are young, it normally peaks at an adolescence and early adulthood. When you are clicking 30 years, it starts to decline, and research says that it is declining 1% annually per year, that is per annum. The testosterone levels drops, and when it drops, there's some things that may happens to you, that there may be decrease in your libido and even erectile function because of that reduced nitric oxides that normally helps to dilate the blood vessels and help in the blood flow to the penis. Remember, this particular testosterone that we have been talking about is very, very important to us men because it helps us to build our bone mass, increases our sex drive, and even fast distribution all over the body, and even red blood cells production, and even sperm production. And it is also responsible for the secondary characteristics of us men, like our voice, our beards, our facial appearance, and our body mass. So when we click 30, it declines, and this poses a very, very high risk to the penile area and the penile tissues, and sometimes you might experience that low libido and even reduced erectile dysfunction. But stay tuned, because we are going to talk about what can we do as men so that even if we age, we maintain our odogu to be stronger and make our ladies reach Mount Everest, to reach the peak of orgasm, and let them enjoy our odogu very well. So kindly note that when you age, physical length does not decrease significantly, only slightly reduction in the girth and the flaccid size, secondary to reduced blood flow that was talking about. So those myths that are revolving around the social media, just brush them away from your mind and stay tuned, because we are going to learn a lot. As a man, as you are aging, you might notice there are some changes in erectile function, particularly when you are clicking 40 most of us men do tend to develop erectile dysfunction. In fact, 40% develop erectile dysfunction when they click at 50 years old. This is because now the vascular system, the flow of blood has been affected by aging, and there is a condition called arteriosclerosis that is now hardening of the arteries that tend to occur with age. And this also results in the reduction of nitric oxide production that we've been talking about. And when there's a decrease in nitric oxide production, then there will be no dilatation of blood vessel, or there will be minimal dilatation of the penile blood vessels. And you know, when there is minimal dilatation, then that erection will be reduced, because nitric oxide play a very, very important role in dilating the blood vessels of the penis. And this one may pose a great risk of erectile dysfunction in this particular male. Well, these changes can be really natural, but they can be interfered with lifestyle factors like smoking, obesity, or even lack of exercise that we are going to talk more about in this particular video. So stay tuned and keep watching. Skin and sensitivity changes may occur in this particular male. You may lose elasticity, and the penile skin area may become looser and even thin out, leading to increased sensitivity, and this might bring some discomfort in this your penile area. Then sometimes you may develop changes in pigmentation, and when you look at your penile area, the skin may appear lighter. This is because of the reduction of the collagen and elastin production. These are natural proteins that keep the skin firm and supple. So as you age, this production normally goes down. And what normally occurs again is that you will tend to pass urine very, very frequent, and you might think that maybe you are developing diabetes, or even you are developing hypertension. So this is due to that elasticity and reduced blood flow to the penis, and this will bring the overactive of the bladder, and frequent peeing will be also occurring. Changes in the hair around the pubic area can be noticed, and sometimes you can notice that your testes are sagging or even hanging, and the skins around there is very, very loose. These are natural occurrences that normally occurs as you age. Kindly note that increased risk of cancer of the prostate and even cancer of the penis normally occurs as somebody ages. And this is not the rule of thumb that as you age, you might develop cancer of the prostate or even of the penis. This is case by case, and it is different in each and every individual. It is not a rule that as you age, you develop this kind of disease. Now, note that your strength will reduce. You will not be as a young man you used to be before. So these are natural attritions that occurs as somebody ages. But now, what can we do as men so that we can maintain this our penile strength? Penile health tips are really, really important, because we want to maintain this particular strength of the penis, because when we do not do this, some of us might develop some psychological torture, psychological stress. They do not know what is happening. Now, exercise is very, very important, and this one I've talked about the KEGELS exercise and normal exercise. This improves cardiovascular system, improves the blood flow to the penis, and this one will maintain our erections to be stronger and the penile health to be strong. Remember, I've been talking about balanced diet is very, very key. Food rich in omega and antioxidant. I've been talking about fruits and green vegetables, which are very, very important, like the ones that are appearing in this particular screen. They are very, very important for us, and as men, we are advised that we should be able to eat at least 5 different fruits daily, so that we can get these antioxidants and flavonoids that are really, really helpful in maintaining the blood flow to the penis, because they also help in the production of nitric oxide, which also help in dilatation of blood vessels into the penile tissues. As we age, we are prone to get lifelong diseases or chronic diseases like hypertension or even diabetes, and this also worsen the erectile dysfunction. Now, we should be able to maintain the clinics that we are attending and maintain the drugs that will help us to manage this particular condition, so that even if you age, your erectile dysfunction should not even worsen. We should be able to stay sexually active. I've been talking about regular erection and regular sex as we age. This is because when you do regular sex, it will improve and promote the blood flow to the penis. And if you have not watched that video, what happens to the penis when you do not perform sex for a very long time, kindly watch this video that appear up here or even in the description below, because I've given tips of how to maintain your penile health. A special advice to our men is that we should be able to stop smoking and stop taking excess alcohol, because smoking normally reduces blood flow to the penile area, secondary to a condition called atherosclerosis, which is hardening of the blood vessels, and this one may interfere with your normal penile health in terms of erection. The nicotine produced in the smoke impairs sperm's production, impairs nerve functions, impair general tissue health of the penile area. So particularly the nitric oxide, which is very important for our blood vessel dilatation and to maintain the erection. So if you excessively smoke, this is likely to occur. And research has also depicted that penile shrinkage is really great in people who normally smoke. And when this has penile shrinkage, there will be reduced sensitivity, and also there will be damage to the nerves that are supplying the penile tissues. Even alcohol will really act as antidepressant and temporarily will depress your central nervous system, and then the signal sending will be reduced and no erection will be taking place. And chronic alcoholism will even damage the penile tissues and even imbalance the testosterone level and even causes tissue stress. And when these ones occur, there will be also reduced sperm production, there will be reduced morphology and even motility of the sperm, and eventually this can cause infertility. So let us maintain our penile health by not smoking, by not drinking alcohol. Now, if the situation is worsening, if you do not know what to do, it's very important to consult sexologist, to consult your physician, to consult your clinical officer or a nurse to help you curb this particular problem, especially when there is worsening erectile dysfunction. If you feel that this video is very important for you, I've talked about drugs, I've talked about what to do to maintain the penile health, and do watch these particular videos that are appearing in this screen, and this will really help you to maintain your penile health. Signing out, this is your doctor, Dr. Pamli. See you in the next video. Muchas gracias.